Section 2, Understanding Key Terminology, Certification and Accreditation. Learning Objectives. Following completion of this session, participants will be able to describe the case for QMS implementation, explain the difference between certification and accreditation, understand the impact of accreditation achievement and QMS implementation, building a case for QMS implementation. Just who is lab? The lab, by definition, should be all those who make laboratory services operate effectively. Chief Health Administrators, Hospital Administrators, Service Providers, Laboratory and Quality Managers, Laboratory Consultants and Staff. It couldn't happen without all of the above. Just who is lab? Hospital Director, Laboratory Director, Quality Manager, Supervisor, Technologist, Nursing Director, Nursing, Technologist. Laboratory quality stakeholder roles and responsibilities. Laboratory QMS and the organization relationship between the lab QMS and an organization's strategic goals and objectives. What do we know about labs? Impact on economies. Disease and outbreak surveillance would be impossible without lab support. Targeted health policy is often informed by lab action and data, GHIV, TB, syphilis, COVID-19, AMR surveillance, NCDs, polio, measles elimination/control initiatives. Lab has an outreach that probably no other arm of the health service can match. What do we know about labs? Impact on clinical care. 70 to 80% of all. Medical decision-making is based on laboratory information. What do we know about labs? Impact on healthcare cost. That there is an increasing use of treatment guidelines that base clinical management decisions on a test result. These guidelines often assume that lab testing has been standardized. Lab. These guidelines assume that there is minimal variation in results from lab to lab, but this is not true. If lab results are not accurate or consistent, patients will be misclassified, incorrectly treated, incur significant cost. Ref. Comenda et al., 2008. Regional Implementation of Creatinine Measurement Standardization. Journal of the American Society of Nephrology 19, 164 to 169. Reflection. If there is now global agreement that a strong economy is linked to a strong health system, and if labs support 80% of medical decision-making and upwards of 90% of surveillance, decision-making, and provide critical disease data to inform health policy, formulation, for targeted intervention, etc., no health system can perform adequately in the absence of accuracy and timeliness of lab services. The evidence is therefore that investment in labs is an investment in national development. References. World Health Macroeconomic. How labs save costs. Patient is anemic. Doctor is looking for the cause and sends blood sample to the lab. Lab is able to detect very small changes in the blood picture because of its quality infrastructure and discusses with doctor. This allows the doctor to recognize an early stage of colon cancer and to manage it. Cost saved, extensive surgery, hospital stay, chemotherapy, radiotherapy, adjunctive treatment, blood builders, etc. Client. Trauma or death. The quality gaps that result in preventable costs. Everybody uses the laboratory, so poor laboratory quality impacts the reputation and image of the laboratory, including the hospital director, MH staff, and MH. Client recall wastage, reagents, labor, time, repeat testing, crisis management, and troubleshooting stressed, unproductive and unprofessional staff stockouts and equipment downtime, sporadic and unreliable service, delayed delivery of results, often too late to be used. The cost of poor quality. Client dissatisfaction. lost reports, poor detection of error, no guarantee of accuracy, lawsuits, accidents and incidents, unprofessional environment. Small problems grow into huge, expensive crises. NV. The cost savings from lab wastage and systems inefficiencies can pay for the cost of maintaining high quality. Introduction to lab accreditation. Procedure by which an authoritative body, accreditation body recognized by ILC, gives formal recognition that an organization, i.e. laboratory, is competent to carry out specific tasks, human health testing, ISO 15189, animal health, food safety, environmental testing, ISO/IC 17025. The recognition is at the international level. Accreditation. It is an independent confirmation that a laboratory is capable of producing reliable and reproducible results within a limited variability on a consistent basis. It's a public statement that we can trust the results produced by the laboratory. Human health testing results ISO 15189 laboratories. Animal health, food safety, and environmental testing results ISO 17025 laboratories. Accreditation versus certification. Accreditation. Procedure by which an authoritative body gives formal recognition that an organization is competent to carry out specific tasks. Modified from ISO/IC 17000. Certification. Procedure by which a third party gives written assurance that a service conforms to specified requirements. Modified from ISO/IC 17000. Accreditation versus certification. ISO accreditation to ISO/IC 17025 or ISO 15189. The emphasis is to establish the technical competence for a defined set of tests, measurements, or calibrations. Laboratory accreditation uses criteria and procedures specifically developed to determine technical competence. Certification to ISO 9001 establishes compliance of the quality management system to the standard. It does not contain technical requirements for lab personnel and operations. Certification applies to the whole organization. Accreditation applies to a specific set of tests, measurements, or calibrations as per the scope of accreditation. Who conducts laboratory accreditations? An accreditation body, AB, which can either be a national or regional accreditation body, can conduct accreditation. Accreditation bodies enter into a mutual recognition arrangement, MRA, with International Laboratory Accreditation Cooperation, ILAC. ABs are recognized by their compliance to ISO 17011, Conformity Assessment, General Requirements for Accreditation Bodies. Accrediting Conformity Assessment Bodies. ILAC's global role. ILAC Global Oversight Entity for ISO/IC 17025. ILAC establishes global standards and requirements for accreditation. Principal International Forum for recognition of competent test and calibration labs worldwide through its mutual recognition arrangement. Development and appropriate harmonization of laboratory accreditation practice. Promotion of laboratory accreditation as a trade facilitation tool and also to provide socioeconomic benefits at national level. Assisting with the development of laboratory accreditation systems. Relationships, accreditation overview. The QMS purpose. Build quality into all aspects of a laboratory's operations through establishing policies, documenting processes, providing procedures, instructions, creating records. The QMS goal. The fundamental purposes of a quality management system, QMS, are to reduce errors in the delivery of healthcare, provide a framework for managing and monitoring activities to meet and exceed quality standards and achieve organizational goals, to create an entire system whereby it is easy to do the right thing and difficult to do the wrong thing. Quality management ladder to success. 100%. 95%, 85%, 50%, 25%, 10%. Living, using, integrating, doing, learning, awareness. The patient in the quality management system. Clinician assessment. Abbreviation, QC, Quality System Essential. Patient. Path of workflow. QSEs. Clinician response. The benefits. Consistently accurate, timely service. Customer and employee satisfaction. Continual improvement of processes. Compliance with regulatory and accreditation requirements. Increased productivity and efficiency. Reduced cost from operational failures. What does it take? Commitment. Resources. Patience. Cooperation. Collaboration. Calling to serve. Time. Who is responsible? Thank you.